I'm Rob.
I'm Mindy.
And I'm Mike.
Welcome to a special edition of Let's Get Ethical, live from the CSRC 2026.
Nice.
Woo! Gotta clap it out.
Yep.
Well, here we are, California, Temecula, Pachanga, CSRC, and we are with the first of 7, right? Advanced Practice Respiratory Therapists.
Nice.
Thank you
Mindy
so much.
Conklin.
Yes,
Thank
Mindy
you for
Conklin.
being
Thank
here.
you so much for joining us today on Let's Get Ethical.
Let's get ethical.
Let's Get Ethical.
Let's get
That's
ethical.
my first time meeting you guys. You guys
Yeah.
are fun.
Thank
now
you.
we have to start over. No, I'm kidding. Well, thank you so much. So
Yes.
just so everybody knows, this is our first time meeting Mindy, and when we met earlier, I didn't ask her to be on the podcast. I simply said, what did I say? I said, oh, I can't wait to have you on the podcast. And she looked at me like I'm crazy, and I am. And I said, well, would you? And I know I forced you to say yes.
No, I talk a lot. I talk a lot. Everyone knows I like to talk a lot.
Awesome.
So let's do it.
Well, you're in good company because I like to talk a lot too. Poor
Yes.
Rob.
Yeah. I just sit here.
He looks pretty.
Oh, that's
Somebody has
that's
to.
debatable.
So this afternoon, you and I had a conversation at lunch. I don't know if you and Matt were talking kind of amongst yourselves, but the conversation was, I wanted to know your story, right? I wanted to understand, and we talked a lot more in depth about the schools and how to start, and I'm excited, I'm going to do it. But you shared your story about becoming an APRT, and I believe you probably shared it on RT Sidebar, but I know it's been a while. Mm-hmm. So I'm wondering if you would take the opportunity to share it with us again, if that'd be okay.
Yeah, absolutely. So my story starts, I fell into respiratory. Like, I had no intention to be a respiratory therapist. I didn't even know what it was. Like, no idea. Mm-hmm. My plan at the age of 31, non-traditional student, I had 3 kids, was to go to nursing school. Went to my orientation and met with my advisor. Her name was Cheyenne, and she said, do you want to be a nurse? And I must have been in the right place at the right time, because I said no.
Such a good answer.
I have no desire to be a nurse. And
Right.
I don't know why I said that at that moment. But then Cheyenne said to me, and it changed my path. What about respiratory therapy? And I said, what is respiratory therapy? I had no idea.
Right.
I had childhood asthma. My daughter had asthma. I didn't know what a respiratory therapist was. So she told me about it. And I was like, okay, sign me up. So 2 years into the program, I was in my second year. She took us to an Ohio State conference. And I was introduced to Georgiana Sirkakis from Ohio State. She's the director there at OSU, Respiratory Care program. And I had never met George before, and she still remembers this to the day. She said, Mindy, one day you'll be in my first APRT class. And I was like, thinking, I'm like, I'm a student.
Were you like, what's an APRT?
Well, yeah, I'm like,
Yeah. First of all, what's an
APRT?
APRT?
I'm like, what's an APRT? And what does this woman from the Ohio State see in me, a student?
What does she know that you don't?
Like a non-traditional student, that makes her believe that one day I'll be in her first APRT class. And from that moment on, like I told you, I was like, this is what I have to do. So everything to where I am now has just kind of fallen in place. And I know where I am now is where I'm supposed to be, if that makes sense.
So what does an APRT do for those who may not know? And I'm sure there's, and I'm be honest, I'm asking because I kind of don't know.
Okay.
What does an APRT do that a respiratory therapist doesn't do? How do they compare? How do they differ?
Okay.
Where do they diverge?
So it's a completely different profession. Okay, we're still in the respiratory care profession, right? But we're expanding to go into that advanced practice provider role.
Okay.
So it's a separate license. throughout the states. It's a separate scope of practice. So we practice above the RRT. So we can do everything a respiratory therapist can do, and then some. Okay, so assess, treat, diagnostic studies, interpret them, do them, perform them, bronchoscopies, thoracentesis, line placement, manage patients in the outpatient setting with COPD, asthma, ICU, critical care, just like any other pulmonary APP.
Mm-hmm.
So think about your nurse practitioners,
Gotcha.
your physician associates. With us, the APRTs, we're going to be working with that supervising physician, similar to like a PA.
Okay.
And we're going to stay in cardiopulmonary. That's what we know as respiratory therapists. That's what we're doing as APRTs. So we're not going to be leaving to go to dermatology.
Got it.
So I think as we grow, pulmonologists across the board are going to love having APRTs, because once we're in the ICU, we're not leaving. Like that's our realm. That's where we are going to shine. So yeah, we function as advanced practice providers, and we don't work independently. We work with a physician, as I think personally it should be done. It should be a physician-led team, and then you extend the care for patients that those physicians can't get to all the time.
Right, gotcha.
Yeah, so they have their really sick ILDs, and then you have all these COPD patients who are trying to get in, but they can't get in because of some of the sicker patients that their pulmonologists are seeing. Mm-hmm. That leads us to where this is a perfect spot for an APRT, especially an outpatient.
Gotcha. Now, I got a question for you, Rob.
Yeah, I love this.
Good, I hope so. I'm asking. So I swear, I heard about APRT. It had to be, I don't know, 3 years ago.
Yes, that's what I feel the same thing. I feel like
I was going to ask, when did you hear about? You're on the East Coast.
I am on the East Coast.
Right?
Yes.
I'll be honest. I'm geographically inept.
Challenged.
Yeah, inept. Completely inept. I have no idea where Ohio is.
Yeah.
But you practice in Maryland. I kind of know where that is.
Right.
I would assume you would have heard of it long before I heard of it.
I actually did, and I it's funny because as we were talking today, Mindy, and you told us how you kind of started this journey about 2019, and you have been a practicing advanced practice respiratory therapist for 3 years, and even you were like, it's been 3 years. And I had to pause for a minute and think, was it 3 years ago? It was probably like 6 years ago that I really started hearing the conversations about, hey, we're going to move the profession into this advanced practice realm. And I know it was mumblings, right? It was grumblings at the time, and I think there were different organizations that were talking about it. And I do remember hearing that the first cohort was starting in Ohio, and it was at The Ohio State University. And of course, I thought, no surprise, right? Of all places, it would be The Ohio State University. I guess, my thought is,
what happened?
Like, how do you...
OH.
Oh,
yeah. Yeah, yes. Or it's The Ohio State University, right? So how... Wow. I have just a weird question. I want you to go back for a second, because you laid out today, like during lunch when we were talking, like this whole... almost as if this plan was there, right, from the heavens, whatever you want to call it. It was laid out in front of you, and you just kind of knew. You had this sensation of all these pieces falling into place. At what point did you tell your family that I have this destiny to become one of the first advanced practice respiratory therapists? And I'm curious, and I think Mike would be curious, what'd your family say?
Oh yeah.
Yeah. So my kids were, when I went to school for the first time for my undergrad, my kids were in like late elementary school, going into junior high. So they knew what I was doing, and they knew I was going back for a bachelor's, because to work at Ohio State at the time, they wanted you to have a bachelor's degree. They knew that I had mentioned the APRT. But my kids, growing up, they forget things.
Absolutely.
But my husband knew when I came back from that conference, at Ohio State, it was an RT conference there, and I told him, I was like, something happened to me today, and I have to work at Ohio. I have to be a part of The Ohio State University, because one day I'm going to be in this program.
Wow.
And he was just like, what are you talking about?
He's like, what?
So I did. Day of graduation from my RT degree, I started my bachelor's degree. 6 months later, I got hired at Ohio State.
Wow.
And I knew in order to practice like any other APP that I needed to be the top of my game as a respiratory therapist. So for 12 years, that's what I strive doing.
Did people think you were crazy when you said, I'm gonna go do this?
Yeah.
That's what I'm supposed to do.
So people are like, why are you going into a program? It's never been done before.
Right.
There's no jobs. There's no legislation. It's a degree with basically a dead-end degree. Like, why would you do that?
Did people say that to you?
Yes.
That it was a dead end. That it was a dead end degree.
Yeah, you're going to waste your money. Well, tuition reimbursement, I didn't have to pay for anything.
Right.
So I wasn't losing. I was gaining a degree, and I knew, and my cohort knew that one day something big would come from it. And I love the 6 that I went to school with. I love them with all my heart. And I couldn't got through that program without them because it was COVID. It was during COVID. But people were just like, what are you doing this for? What is it? So I had a lot of questions, and my answer was, I'm doing it for my kids.
Yeah.
Like,
wow.
I think when you become a parent, you realize there's a bigger picture, and you want to be your kids' role model.
100%.
And so I was like, I don't want my kids to have any other role model. I don't care about these musicians who sing or who they hang out with school. I want them to be like, my mom did something no one else ever did.
Oh, that's so
and I want to
cool.
be like that. So that was kind of my why. So that's how I would answer it. Well, why not?
I love that. Why not?
Right, why not? What do I have to lose? Nothing.
Nothing.
My tuition's paid for. I get a master's degree, which you can do anything with.
Correct.
Even though it's specialized for APRT, I could have went into management. I could have done sales. I could have done all kinds of things. I just knew one day something big would happen. In 2023, it happened. That first job posting. And I told my husband, I was like, I have to apply. And he said, we cannot go to Baltimore, Mindy. Have you seen Baltimore? And I'm like,
have you seen Baltimore?
I don't even know. I didn't even know where Baltimore was. I knew it was the East Coast. Mm-hmm. So I planned a day to go meet Daniel Witt at the VA. So we took a road trip. It was about 7 hours. My youngest went with us. She was a teenager at the time, like getting ready to graduate. And when I went into the VA, it just felt like home. And nothing, I thought I would retire at Ohio State. Like, I thought that was I'd be there forever.
You were committed.
I'm committed.
Committed.
I never thought I would leave. But this was like the bigger picture, and I didn't do it for myself. And I think people have a hard time believing that, but it's for the betterment of our patients and our profession. It's not about me.
Well said.
It's not the Mindy show. It is, let's grow together. And I just want people to understand this.
You're very humble.
Yeah.
And
Yeah,
for someone
awesome.
who has risen up, into your, your position, it isn't just, yes, your clinical position, but you're paving the way. Like, you are out there paving the way. And I will tell you, and I think Mike would agree, we were talking earlier again about your work schedule and your personal schedule, and you coming out here and speaking today to this great group of the CSRC. And I don't want to monopolize all the time, but
Good.
Mindy, what do you do for downtime? Like, what do you do for fun,
Wait,
girl?
before you get to that.
Yes.
Yeah, before you get to that. So I want to talk about paving the way. Because you've been from, what's the furthest you've been on the East Coast? All the way to Hawaii.
Oh, yeah.
Yeah.
Raising awareness is what you're doing, right?
Yeah. I mean, talking to I only have a few states left, so I'm hoping to hit every state within the next couple years. Between
All
the 5
50?
years. Yes.
How many have you hit so far?
37.
Oh my God.
Wow.
So I don't have too many more.
I'm all excited because we've spoken in 3 states.
That's
right.
Yes.
So I have all of the South.
47 to go.
I have all of the South, all of the East Coast besides Maine and Connecticut. Is that East Coast? Yeah, that's up there. And South Carolina, I still have to do that. But in North Dakota, South Dakota, those kind of places. But it's just not talking to RTs. It's talking to physicians, to other advanced practice providers, to industry, to pharmacists, to let them know, hey, we're going to be prescribing, given, states allow us to. This is what we're doing. And I want everyone to understand what an APRT is, the definition, what the scope of practice is, that it's not an RRT. You just can't have a master's in respiratory care for education. You have to have that clinical master's program. It's completely different. So I want everyone to have that understanding and know that we are an up-and-coming APP. We're 3 years in, but so much has happened in 3 years that in, I think, the next 7 years, you're going to see multiple programs, a lot more APRTs practicing, licensure passed, and eventually we'll get CME reimbursement from like CMS. Yeah, that would be.
I love that. So you made a 5-year prediction, a 7-year prediction. If you think about it historically, right, it's almost as like the birth of the respiratory care profession, right? We started like in the late 1940s.
1946, ITA, 1946. Yep.
And into the
Disputable
60s
question, everybody.
Right? Into the 60s, the first RT was a nun, right? Yep. And then it became this just organic, developing, evolutionary process of where respiratory therapists are today. And that's right. She was licensed number 1, right? Yeah. And you're like, you in your first group, but I think even you are that torch, right? That's lighting the way forward for our profession. And we were talking about advancement and where to go. Here's another pillar, another place for RTs that say, man, I love where I'm practicing, but I want to elevate my practice. And I love the way that you speak to the collaboration, for example, within the VA system, and how you collaborate with your other providers and the doctor and the patient, right? You help to complete that circle as that advanced practice respiratory therapist. But I'm going to go back to my other question.
Now you can. I just wanted to cover that really quick. What do you do in your downtime?
All of this that you do.
When do you get downtime?
What do you do for fun? Tell us, how does Mindy relax? What does Mindy do have fun? Mindy runs. Mindy exercises.
Mindy exercises. I do my Peloton. I sing very loudly, and my husband is like, you can't sing for one. But when I have my headphones on,
let's find out.
No,
you got a couple mics here.
So, and I'm a Swiftie. I love Taylor Swift. Okay, so anything on Peloton that she has, I will ride or run to, and I'll be riding and singing these Taylor Swift songs. And my husband now is like, when we drive back to Ohio, he's like, can we just listen to some of that Taylor Swift? Because you make me like the music.
He's going to hate that you said that. But I'll tell your husband, it's okay.
Yeah.
I had teenagers when Taylor Swift was first becoming a megastar. I know all the words. I'm not proud of it, but I know all the words. If her song comes on, I'll just be like mouthing the words.
I'm proud of it. I'll be the first to say. But I think it's being a female and taking control of your career. She's a really good role model for other women.
100%.
Yeah.
And I actually had, I think it was David Vines. David Vines or Brady Scott, one of the two. When I first met them, they're like, you are the Taylor Swift of respiratory therapy.
Oh, wow.
And I was like,
wow.
That's really
You're the Taylor Swift of APRT.
I'm so excited.
That's not your new title, That's your new title.
Yeah.
The Taylor Swift of respiratory therapy.
Absolutely. That's you.
I took that as a compliment, but I have a dog, and he takes up all my time. So he is a Bernie Doodle, and he loves to walk, and he loves to cuddle. So that's my time. I don't need to do nothing fancy. I'm not high maintenance. I hang out with my husband. We play cards. I don't do anything that I shouldn't. We travel. So
you travel a lot.
And I just go home. I have a grandbaby, so now I can go home and spoil him. So,
that's awesome.
Yeah.
And you're living the life you were meant to.
I'm living.
That's what I think is awesome, is that you don't just believe it, you know it.
Yeah.
That's really cool. So just as we close out here, what if you could take your hour-long presentation that you do at every, in every state, and sum it up into a few sentences, what can we do to advance our profession and get it moving in that same direction? What are the biggest roadblocks that you see as you've been going state to state?
I think the biggest roadblock is getting people to truly understand what the role of the APRT is. And if it wasn't for me going state to state, city to city, doing Zoom calls, I don't think everyone would know what the APRT is, right? So I think it's important for me to communicate what I'm doing in my practice, so respiratory therapists can go back and spread the word to other respiratory therapists.
So it's important then to understand that APRT is not respiratory.
Correct.
By definition, it's not respiratory. Maybe in name it shares a name,
right? But
it's not respiratory. It's completely different.
Yeah, so it's a completely different profession. We are respiratory therapists, however, we work now as that advanced practice provider.
So you work
yes.
respiratory therapists. But
yes.
you have, okay, all right. I think that's important for people to understand.
Right.
Yes,
it's important for people to understand that and maybe that's a fault is we fall with, because that's, I'll be honest, until you told me that, I thought that APRT was just another direction we could go as therapists, and while it is, it's also not, right?
Right, so yeah, it's a completely different thing, and we're managing that patient.
Yeah.
With our collaborating or supervising physician. But I think we need to get people involved with the AARC, because without membership, how can they continue to support the things that we need? APRT, compact licensure, everything else. Get involved with the state society. If you want a program and you're like really adamant, I need to take Mindy's path because this is what I've always wanted to do, and you're ready for that, be vocal and talk to your state society and see what you can do to start having legislation talks, putting a bill together, seeing what university would be best to build a program.
Right.
Because there's certain places that you should build and certain places that you shouldn't build, right? You want a university that has maybe a PA or NP program, so you can use some of those classes, like Ohio State did. And I tell everyone, no one can't tell me that I don't have the same education as a nurse practitioner.
Right.
I took the same courses as they did, and I passed them all just like they did. So
that's awesome.
Yeah.
Rob, do you have anything else before we close out?
I think you've done an amazing job today. Thank you so much for joining us.
Thank you so much for coming on. It's a pleasure to meet you,
Yes.
and we do want to have you on again because we do want to dive into some ethical issues when we have more time. I feel like we've monopolized your time, and I know that there's other people that want to talk to you, and the hell with them. No, I'm kidding.
Yeah, it's okay.
I'm teasing.
They have all my socials. They can text me if they need to.
But we do appreciate you coming on and taking the time. And for everybody who's listening, who's watching at home, if you guys are intent on following this path, get involved. State Society, AARC, 100%. Let's make this happen. I'm excited. I wish we could get it in California.
Oh yeah.
We're trying, but it becomes a legislation. And you gave me a trick to the path earlier. I'm not going to share it.
Yeah.
Because
legislation to work outside the government, outside the VA system, you have to have licensure. The VA system is a really good way to get the APRT, and we're working on that on our end in the VA to make it nationwide. So any VA would be able to
that'd be awesome.
Incorporate an APRT into their healthcare system.
That would be
that
super
is in the works. I can tell you that.
All right. Well, hopefully it gets there quick, and hopefully we can help push this along.
All right.
But we're going to close it out. Thank you so much. It's been a pleasure. Thank you guys for listening and watching.
Thank you.
If you have questions, comments, let's get ethicalpodcast@gmail.com. Hit the like and subscribe button. It'll be somewhere on this screen. And Rob, why don't you go ahead and close us out?
All right. Thank you, everybody. And live from the CSRC 2026. Join us next time on Let's Get Ethical.